The Asian Pacific American Network of Oregon asks, what's your healthcare story? APANO asked a group of Asian and Pacific Islander community members.
My name is Jennifer.
My name is David.
My name is Anselmo.
I'm Andrea.
My name is Madeleine.
Questions about their unique and diverse experiences in accessing healthcare to better understand what works and what doesn't work to keep our communities healthy. APANO asks, what does a good healthcare system look like to you?
I think a good healthcare system would be one that's very accessible, very, catering to the different needs. I think one that's probably less expensive, because that's a big problem. People can't access it because of the price. So I think one that people are comfortable learning more about or reaching out to either gain access to healthcare or talk to the healthcare providers or their doctors. So I guess one that's more friendly to to everybody. Mm-hmm. Yeah.
For me, a couple things that I had talked earlier about. I would like to see the training for those working in the healthcare, that they have when they're learning for that profession, whether that's someone who's taking blood to someone who's performing the surgery to someone who's checking in a patient. They have training ongoing around all of these issues. What does it really mean to be culturally responsive to the people who you are serving? Not just the one-day workshop, but ongoing training. And so I want to see that stronger connection between those who provide healthcare and those who are receiving it, especially in the API communities. And I'm not seeing it yet here.
Yeah, I think we always call it like the medical model, which is that we address issues once they become severe enough to be a problem. We call that the medical model in the mental health field. And I think that we need to change this whole model around that health isn't it doesn't become a healthcare issue once it becomes a problem. It should become a healthcare issue even before problems ever arise. So a lot more money and focus on prevention, early intervention, education, like making sure that our community and everyone knows, what do you do if? It's not like, only when you get to a certain age or only when you're going through certain life experiences like pregnancy do you start to get educated about what do you do, but it should start from the very beginning in our education system. And also a lot more focus and a lot more recognition about prevention that's different for different communities, and spiritual practices starting to be recognized as a legitimate prevention, or certain, even sports for children and things like that as becoming like that. Yeah, that is part of our medical care, is that we make sure our children have enough exercise, are eating healthy food, having their cultural food represented in the cafeterias and things like that. That's just, I feel like our system's so siloed of like mental health care comes over here and then medical care over here and then early education over here. And it just, we're not talking to each other. And I think that there's, we need to have a more holistic understanding of what health is, and then also start to talk with each other more about it.
Yeah, I guess going off of that, in one of my classes we were talking about a recognition of issues, and I think somebody brought up a good point that a lot of times people don't want to recognize that there are issues because it'd be admitting that there's a problem and that the system is not working to what it could be. And so to admit that you're wrong is kind of a very hard thing to do, especially with such a the healthcare system is like so big. So I think that's one of the problems, that to admit that you're wrong, people don't want to do that, so they'll just keep it the way it is.
Mm-hmm.
A good healthcare system to me would look like, more geared towards the poor or people in the poverty line, because, they don't know where to go. Like, we're in the United States, and I feel like we have like one of the better, healthcare systems in the world, but a lot of people don't get access to it. So I feel it's kind of ironic in a way, because, how do how do you claim yourself to be like one of the better healthcare systems in the world if you can't even provide healthcare to your own people? You know, that's why where I feel like it's kind of a little corrupt right now, and I feel like there's got to be something to be done about it, because we're spending way too much money on like politics and with the war right now, and I feel like, you know, we're dropping a lot of money on this, and like this, why can't we just use the money towards the people in our own country? We worry about other people more than we worry about our own people, and I feel like that's kind of sad in a way, because, you know, we're supposed to be representing, you know, we're supposed to be a power nation or a powerhouse pretty much towards the rest of the world, and we're like presenting ourselves pretty weak. If people see images like this, it just makes our country look bad. So I feel that, you know, a good healthcare system should have easy access towards everyone else.
Right now, I don't have a really good idea of what would be a good healthcare system or what it would look like, except for just a generalized idea of it should be accessible to all different people. It should be easy for everyone to be able to access it, no matter what level of education you are or the amount of money you make. No matter what, people shouldn't be afraid to go to the hospitals because they're afraid, oh, I'm going to get a bill and I'm not going to be able to afford it. That's more stress on them. Like, we should try to make a healthcare system where people don't have to stress out about not being able to afford just getting care where they need it. I think overall, as long as it's affordable and it's culturally competent to everyone, because everyone we come from different backgrounds, we come from different cultures and different traditions and practices that we practice within our families, that physicians or clinics, they can't see what barrier they may cross and what they wouldn't. So I just say, as long as everyone can be happy.